If you want to take 9 minutes, maybe you don't need to. Once you have read, tell me, I'll go next. Yes?
Next.
Yes.
Next, ma'am.
Yes. Just a second. Yes. Yes?
Yes, I'm ready, ma'am.
Yes. So I'm starting the timer considering the communication skills station. Kindly begin.
I'll enter the room and pick the phone.
Yes.
Hello, good morning. I'm Dr. Tolu Ogunfora.
Okay, yeah, doctor, good morning. Good morning.
Yes, I'm calling to speak with Mr. Mann, a consultant orthopedic surgeon, to inform him about a trauma case.
Okay.
May I confirm if I'm speaking with the consultant orthopedic surgeon?
Yeah. You are talking with the head of the trauma team. Yeah. It's late. Go ahead, doctor. What is the problem? Go ahead.
Thank you, sir. I have with me a man who was just admitted. He's a 20-year-old motorcycle rider who was brought in initially unconscious and but subsequently regained their consciousness after evaluation with a Glasgow coma score of 15/15. He was subsequently admitted. He had some investigations. X-ray showed an open left tibial fibular fracture. He also had an initial ultrasound which he had ultrasound which showed fluid in the right in the paracolic gutters. Significant findings were also in the abdomen. On the examination, he had abrasions in the left flank, and he also had abdominal distension. And the limb was cold, insensitive, and he had worsening pain prior this. I'm calling you to update you about his case and because of the severity of injuries that he has.
Yeah, doctor, it's good you call now, but what is most important at this point? What is most urgent, doctor?
Yes, sir. The most urgent about him is the open left tibial fibular fracture with a cold and pale insensitive with limb and the absence of pulsation in the left limb, and also had a worsening pain. I'm thinking he could have a vascular injury and also with a compartment syndrome, and he needs urgent attention.
Okay. What are the causes of the limb? Why do you think the limb there's no pulse there right now? No pulse. What's the problem?
An open fracture with a significant vascular injury in him could cause that. Also, it could be as a result of compartment syndrome. And vessel spasm, especially an arterial spasm, could also result in this condition, sir.
Is this patient on cervical collar to start with?
I'm not sure, sir. I will confirm and I will get back to you immediately.
Is the patient conscious as we speak right now?
Yes, patient is conscious as we speak
right now. You sure of that, doctor? Okay. What is your plan? What is your plan for this patient? What's your plan really before
since the patient is hemodynamically stable, the urgent thing is to, because of the suspicion of a compartment syndrome, he will need a review by the orthopedic surgeon. You also need a vascular surgeon to review him. I will stabilize his fracture. I will reduce his fracture and stabilize his fracture in preparation for a possible fasciotomy that you need to have urgently. Also, because of the history of consciousness, I will do a CT of the cranium and the brain. Also, CT of the abdomen will also be done, and including the pelvis, because of the ultrasound finding of a fluid in the paracolic gutters.
Is this patient dehydrated?
I'm sorry, sir. I'm not sure, but I will confirm and I will call you immediately to update you, sir.
Okay, what's the SpO2 of this patient?
The patient is conscious, but I'm not sure of the SpO2, sir. I will confirm and I will get back to you immediately, sir.
Do you have a value of the blood glucose, doctor?
No, sir, I don't have it with me.
Okay. Now this patient has abdominal distension, like you said, and now you are worried about compartment syndrome. Why are you calling me really? Why? Why not the general surgeon? Why are you calling? Why not the general surgeon?
Although this patient is polytraumatized, I'm calling you really, sir, because of the priority injury that he has, because of the risk of ischemia of the limb and him having compartment syndrome, because of the extreme pain, worsening pain, cold and insensate, and the pulseless limb. That is a priority injury, sir.
Okay. Now you said there is fluid in the paracolic gutter and abdominal distension.
Yes, sir.
So how are you going to handle both of them? What do you think? With the limb and then the bleeding into the abdomen? What is your opinion, doctor?
Well, the bleeding into the abdomen, you could also have sustained a blunt abdominal injury with hemoperitoneum. And this could be from liver or spleen laceration, which are commonly injured, which ultrasound has confirmed that he has this. I will do a CT scan to confirm this injury. But about this, I could do a focused abdominal sonography in trauma, a fast scan, to also check other areas. The Morrison's pouch, the pericardium.
Okay, doctor, is there any investigation you will do before the orthopedic surgeon who will handle this case will come? Any investigation on the limb?
Yes, I will do a Doppler ultrasound of the limb to assess the integrity of the vasculature.
Would you rather do a duplex?
Yes, duplex.
Okay.
Thank you, sir.
All right. There's no problem. Arrange for a consult to the general surgeon and arrange for a theater so that we see how we can have a combined session. Is that okay?
That's okay, sir. I'm grateful, sir. I will do that immediately. Thank you, sir.
Who else would you involve in the
Who else will you involve?
Discussion?
The vascular consultant will be involved. The anesthetist will also be notified. The orthopedic surgeons,
general surgeon,
yes,
trauma
the
surgeon,
general surgeon,
plastic surgeon.
And plastic surgeon.
Here, examiner will ask you why plastic surgeon. So what would you say? You still have 45 seconds, so you should be able to tell me. And there's free fluid in the abdomen, so there'll be indication of emergency laparotomy.
Okay, ma'am.
Okay, so how would you end your conversation?
I will thank my consultants and the things that initially summarized. If he asks me for another summary, I will summarize briefly.
He can, because he did give you some advices. So what is
the advice? The advices are to involve other specialists, the general surgeon. Yes.
Right, and then asked about if the patient is dehydrated or if the patient has about the blood saturation. Here they said all the tests are within normal range except for CRP, which is raised. So that was what was given, but if examiner asked you other than that, so your answer was appropriate, that I'll get back to you. I'll confirm and get back to you.
Thank you, ma'am.
Thank you.